Hello, I'm Dr. Phillip Yoo. I'm the founder of the 21st Century Laser and Magnet Med Institute here in Newport Beach, California. Today I'm going to show you what new technologies we use to manage chronic pain and neuropathic disorders such as peripheral neuropathy, which causes numbness, tingling, pains, prickling sensations, mainly in the lower extremities of the calves and the feet. So here we're treating Phyllis here, and she's getting two types of therapies. One is class 4 laser therapy, which our nurse Lauren is applicating right now. And what that does is it creates a substance called nitric oxide, which dilates the blood vessels to get circulation and nutrients into the legs. And what that does, it makes sure the nerves and all the anatomical structures get the nutrients they need to be able to regenerate normal nervous tissue. Now, when you have these peripheral neuropathies, there's usually three different causes. One, probably the most major cause is diabetic neuropathy, and the reason why is when the pancreas cannot process the sugar you're eating, the sugar kind of oxidizes. It's like a rusty nail. It kind of, a rusty nail, it kind of flakes off into sharp shards. Well, that's what happens to the sugar. It oxidizes, become hard, and because of gravity, it starts settling in your hands, mainly your feet, and that interferes with circulation, causes nerve damage. Okay. The other therapy we're doing here is we're applying a pulsed electromagnetic field therapy. And this therapy was actually featured on the Dr. Oz show, and it is FDA cleared for post-operative pain, swelling, and bone fractures. Because what the field does, it puts these waves of ionic energy into your body and stimulates the healing processes, circulation. It also increases stem cell production of a factor of 400%, so the body can regenerate itself. With the case of peripheral neuropathy, what happens is every nerve has a surrounding cover. It's kind of like any cable that has wires in it, because their nerves are wires, they conduct electricity, which are messages from your brain to your feet, to tell the feet when to sense things and to move and to have normal reflexes in circulation. What happens is with peripheral neuropathy, let's say this is your nerve in your feet, this cable, the rubber part, peels off. And then you have disoriented messages to the brain, which can be interpreted as numbness, pain, electrical sensations, tingling, and eventually muscle dysfunction. All right? So what the laser does, what we're doing here, and let's say this is the nerves in your feet, it'll stimulate the regrowth and regeneration of that outer covering of the nerve to normalize the electrical synapses between the brain and your feet and normalize the function so your symptoms disappear. Okay? So right now, Phyllis, could you tell us how you felt after a few therapies with the laser magnets for your feet? What did you feel before?
It was excruciating pain when I put on shoes. I couldn't wear shoes that much because my toes, they got squeezed together, and my feet up from the bottom were killing me. When I came here, I didn't know what to expect because I never had gone before. And I'm glad I found you. I feel a lot better. I just get a little like the tingling that I told you before, and my toes once in a while bother me.
Okay.
But other than that, I don't have any pain on them. And I can sleep without any socks or anything on.
All right.
I feel it feels normal.
And this is Phyllis's world-famous neurologist husband, Dr. Ted Thompson. All right. And Ted, could you tell us what Phyllis tried for the neuropathy in her feet before bringing her here?
Well, Phyllis is a doctor's wife.
The cream, remember?
And she's tried various creams. She's tried more different shoes, almost as many as Nelda Marco.
Yeah.
And we're going broke buying shoes. And she just gotten some relief from this. And I if you can handle this without these medications and so forth, and by your technique, obviously a result is a result, and she seems to be quite pleased, and I'm certainly pleased.
Great.
And
Now, in your professional expert opinion as a clinical neurologist, now the plethora of patients you've seen for peripheral neuropathy, how did they respond with the traditional, the nerve medications that you prescribed?
well, I really haven't seen that many, but I can think of a couple of cases where there was just excruciating pain, and one's a longtime friend of mine, a fisherman from in Southern California, and I won't give you his name, but I know his name, and he was just in terrible pain, and I really could do nothing for him.
Yeah.
I couldn't do anything for him, and he was a very good friend, and he just kept calling and so forth, and he was just in excruciating pain, and that's one example where I believe if we have this opportunity, your opportunity now, and his name was Gene Brooks, and he lived over in Redondo Beach and so forth. I'll even give you his name. He was a dear old friend, and he suffered, I know that, and I'm sure his wife's still alive, and I'm sure she would agree that, and they had twins, and I felt terrible because there just was nothing he expected something from me, and I couldn't deliver.
And now that we have this new technology,
I would recommend it, I really would. And,
He did right away.
it's just sad that it wasn't available sooner, and I think anything that would, pain really brings people to doctors, and anything that can get a result, a positive result, and your special lasers apparently are doing this. You're like a chef, you know, with treating where the electrons go, isn't it? Acidity, basicity, and so forth. Something's happening here that gives relief, and why not? I mean.
and Doc, you were actually a personal advisor to President Bill Clinton, right?
Well, no, I was a friend of Bill Clinton.
Oh wow. Yeah.
Well, my father was a friend of Bill Clinton, basically, and established Thompson Industries in Russellville, Arkansas, and I'll say Bill Clinton did a great favor for me because they had treated 50,000 railroad ties in Arkansas and stacked them in the salt flats, and they treated with creosote, and of course the flats were this is the salt flats we're talking about. And if you treat, wood technology, you can't treat creosote ties in Arkansas and stack them on the salt flats for 2 weeks. They were building a railroad spur, and so it's almost unbelievable. But
now, Doc, so what we've created here at our concierge clinic here in Newport Beach is what we call presidential caliber care. Would you agree that we are able to provide that with our top-line staff, equipment,
I would have
and
to say you
procedures?
have a good thing going. I really think you do.
All right, well, maybe we could get
Very
Obama
good.
here
There we go.
and show him these non-invasive therapies, and we could change and transform healthcare
We
together.
would
right?
certainly hope so.
Okay. All right, folks, thanks for watching, and we'll check in later.